In the chaos of World War II, life and death really hung by a thread, and the frontline medics were more than just caregivers. They were miracle workers. They didn't have MRI machines or sterile surgical theaters, yet somehow they performed life-saving procedures that would leave modern doctors blinking. Their secret hacks were born from necessity, creativity, and a flat-out refusal to let a comrade die when resources were scarce. These were battlefield surgeries that defied logic and, honestly, still inspire medical professionals today. A medic in World War II didn't walk into a hospital with gleaming equipment. The battlefield itself was their operating theater, with sand, mud, and blood-soaked uniforms as the backdrop. They learned to improvise with what was on hand. Blankets became tourniquets, belts became splints, and even soda bottles turned into makeshift suction devices. Speed and ingenuity weren't optional. They were survival. Every second counted. Wounds that would have been fatal in a field hospital became survivable because these medics understood the anatomy of trauma with real precision. They weren't waiting for lab results. They relied on instincts sharpened by constant exposure to injuries that modern medicine rarely sees in such raw form. One of the most astonishing things about World War II medics was their ability to think outside the box. When antibiotics were in short supply, they found alternatives in the natural world. Honey, plant extracts, and even mud poultices were sometimes used to prevent infections. They experimented, carefully observing which methods worked on different wounds, from shrapnel to gunshot injuries. It wasn't reckless experimentation, it was field-tested innovation. Medics developed surgical techniques on the spot, often under fire, and found ways to control bleeding that modern textbooks still admire. They mastered pressure points, vessel ligation, and wound packing in ways that would make a surgeon today stop and take notes. We all know about tourniquets, but the medics of World War II turned them into precision tools. They understood that improper application could mean the difference between saving a limb and losing it forever. They created adjustable systems with whatever they could carry, rope, wire, or even torn uniform fabric, and paired it with constant monitoring to avoid permanent tissue damage. Their approach was equal parts science and streetwise cunning. They didn't stop there. Medics also used gravity and simple hydraulic tricks to manage bleeding. By elevating limbs or using pressure with readily available objects, they could stabilize patients long enough to make evacuation possible. The methods were simple, elegant, and shockingly effective, proving that innovation doesn't always need cutting-edge technology. Morphine and basic anesthetics were available, but not in unlimited supply. World War II medics had to improvise to reduce pain and trauma for soldiers. They combined techniques such as ice packs, nerve pressure, and distraction methods, anything to dull the pain, while performing critical procedures. The mental component was just as important as the physical, and medics became experts at calming soldiers, reducing shock, and buying themselves precious minutes to operate. Infection was the silent killer, far deadlier than bullets. Medics discovered that clean water wasn't always available, so they adapted. Boiling water over improvised fires, creating antiseptic solutions with alcohol or iodine, and using layers of sterilized cloth were all part of their toolkit. They learned quickly that improvisation could mean the difference between life and gangrene. Some of these techniques, like wound irrigation under pressure, are still recommended in trauma medicine today. Believe it or not, some of the battlefield techniques from World War II medics influenced modern trauma protocols. Fast amputation procedures, emergency tracheotomies, and battlefield triage systems were refined in those desperate years. Medics didn't just patch up soldiers. They studied outcomes, documented what worked, and pushed the boundaries of what was possible in life or death conditions. These unsung heroes also taught that preparation and mental toughness were just as crucial as skill. They could anticipate the types of injuries that would come through, set up field hospitals in hours, and orchestrate chaotic evacuations, all while under fire. Their efficiency was surgical precision meets improvisational genius. What's truly remarkable is how these hacks transcend war. Modern emergency medicine owes a debt to the improvisation, observation, and relentless courage of World War II medics. They proved that with knowledge, adaptability, and the courage to act fast, a life could be saved even when the odds were stacked impossibly high. Every medic knew that innovation didn't wait for permission. They learned to operate under pressure, trust their instincts, and turn scarcity into opportunity. And in doing so, they wrote a manual of wisdom that anyone interested in survival, preparedness, or extreme medicine can learn from, even today. So, if you're fascinated by the raw ingenuity of frontline warriors, remember the medics of World War II. They didn't just heal, they conquered chaos, redefined emergency care, and left secrets that still beat modern medicine in resourcefulness and speed. Don't forget to hit subscribe and share this channel with anyone who wants to see history's hidden lessons come alive. On this channel, wisdom from the front lines isn't just a story, it's a survival guide.